Polycystic ovary syndrome (PCOS) is a common endocrine disorder that affects people with ovaries, particularly during their reproductive years. It is characterized by hormonal imbalances, irregular menstrual cycles, and polycystic ovaries. PCOS can have a significant impact on physical health, reproductive health, and psychological well-being. The exact cause of PCOS is not fully understood, but several factors are believed to contribute to its development. Genetic factors. PCOS often runs in families, suggesting a genetic component. Specific genes may predispose individuals to hormonal imbalances. Insulin resistance. Many individuals with PCOS have insulin resistance, which means their bodies do not respond effectively to insulin. This can lead to higher insulin levels, which may stimulate the ovaries to produce more androgens, male hormones. Hormonal imbalances. Elevated levels of androgens such as testosterone and irregularities in hormones that regulate the menstrual cycle, including luteinizing hormone LH and follicle-stimulating hormone FSH, are common in PCOS. Inflammation. Some studies suggest that low-grade inflammation may play a role in the development of PCOS. Symptoms of PCOS can vary widely among individuals and may include menstrual irregularities, irregular or absent menstrual periods, heavy periods, menorrhagia, excess androgens, hirsutism, excessive hair growth on the face, chest, and back, acne and oily skin, thinning hair or male pattern baldness, polycystic ovaries. Ovaries that may be enlarged and contain numerous small cysts visible on ultrasound. Other symptoms: weight gain or difficulty losing weight, insulin resistance symptoms, such as dark patches of skin, acanthosis nigricans, mood swings, anxiety, or depression. Diagnosis. Diagnosing PCOS typically involves several steps. Medical history. Healthcare provider will take a detailed history of symptoms, menstrual cycles, and family history of PCOS or related conditions. Physical examination. An assessment of physical signs, including weight, body hair distribution, and skin changes. Laboratory tests. Blood tests to measure hormone levels including androgens, FSH, LH, and insulin, and rule out other conditions. Ultrasound. The transvaginal ultrasound may be performed to check for the presence of cysts on the ovaries and assess their size. Treatment. While there is no cure for PCOS, treatment focuses on managing symptoms and reducing the risk of complications. Lifestyle changes. Weight management. Losing even a small percentage of body weight, 5 to 10%, can help regulate menstrual cycles and improve insulin sensitivity. Diet and exercise. A balanced diet low in refined carbohydrates and regular physical activity can help manage weight and insulin levels. Medications. Hormonal birth control. Combined oral contraceptives can help regulate menstrual cycles, reduce androgen levels, and improve acne and hirsutism. Anti-androgens. Medications like spironolactone can help reduce hair growth and acne by blocking androgen effects. Metformin. This medication, commonly used for type 2 diabetes, can help improve insulin sensitivity and regulate menstrual cycles in some individuals with PCOS. Fertility medications. If pregnancy is desired, medications such as clomiphene citrate or letrozole may be prescribed to stimulate ovulation. Mental health support. Therapy and counseling may be beneficial for those experiencing anxiety, depression, or other emotional challenges related to PCOS. Complications. PCOS can lead to several long-term health issues if not managed appropriately. Infertility. Hormonal imbalances and irregular ovulation can make it more challenging to conceive. Metabolic syndrome. Increased risk of insulin resistance, type 2 diabetes, and cardiovascular diseases. Endometrial cancer. Prolonged irregular periods can lead to an increased risk of thickening of the uterine lining, endometrial hyperplasia, which can progress to cancer. Sleep apnea, increased risk of obstructive sleep apnea, especially in individuals who are overweight. Mental health issues, increased risk of anxiety, depression, and body image issues due to symptoms such as hirsutism and weight gain. Conclusion: Polycystic ovary syndrome is a complex condition that requires a multidisciplinary approach for management. While PCOS can be challenging to live with, understanding the condition and implementing lifestyle changes, along with medical treatments, can help manage symptoms and reduce the risk of complications. If you suspect you have PCOS or are experiencing symptoms, it is important to consult a healthcare provider for proper diagnosis and treatment options.